Congenital Talipes Equinovarus etiology compromises of multiple factors. It's actually one of the most common disorders of unknown etiology. This is kind of revealing that despite the multiple risk factors and associations, exact etiology of this disease is actually unknown. We do not know the exact cause of what is actually causing this etiology, but there are certain factors which have actually resulted in increased predisposition of this disease and increase chances of the pediatric age population having this problem as compared to the those who are not having this problem. The most commonly theory which comes as a germline defect, which is seen in the talus formation, because there is the problem is actually at the level of there are, as you know, the foot is divided into forefoot, midfoot, and hindfoot. In the midfoot, there are tarsal bones which include naviculum, then medial, middle, and lateral cuneiform, cuboid, and then you have in the hindfoot you have talus and calcaneum. So this articulation is actually disturbed, and this disturbance of articulation is what actually causes this problem. One of the theory is that there is a germline defect in the development of the talus. As a result, there is abnormal development of the talus in which the talus points more downwards and it medially rotated, and as a result, when this happens, all other bones actually go into further rotations and displacement, leading to this sort of a problem. Other is arrested development. This is another theory, as we know that no exact cause is known, but this is one of the causes that why this actually happens. That is, due to certain causes, there may be an arrested development at the talocalcaneal joint. The talus is the problem area which is not developing the way it should be developing. As we know, the talus is a bone which has almost three parts. It has a head, it has a neck, and it has a body with posterior tubercles on medial and lateral side as well. So it has to develop, it does not develop from a single ossific nucleus, it develops from multiple ossific nucleus as well. So when it is developing, one of the ossific nucleus may get arrested in the development, and as a result, there is actually the maldevelopment of the talus, which leads to this problem. Then it has been associated with certain neurological disorders as well, and such as myelomeningocele, spina bifida, it may be present along with it. And one theory is that there's actually the neural axis abnormality which also results in this problem. Then neural tube defects, which may also be seen along with this problem and is being associated with this issue as well. Then comes the genetic factor. As we know, the exact cause is not known, so it's multiple theories have come up that probably it's something to do with the genetic defects, the way the bones develop, and especially where the talocalcaneonavicular joint develops, because this is where the real problem is at this junction. It's actually the first talus goes into maldevelopment, then it pushes and rotates the calcaneum, and then the naviculum actually develops wrongly, eventually creating a deformity which becomes, in which the foot is seen like what is you see in clubfoot. That is, there is a Cavus, Adductus, forefoot Adductus with hindfoot Equinus and Varus as well. There are multiple associations of certain diseases with this. For example, it has been associated with arthrogyphosis, which itself is arthrogyphosis multiplex congenita, the disorder of 129 syndromes almost. There are a lot of syndromes which are actually associated with it. Then it may be associated with neural defects such as myelodysplasias, neural tube defects. They may be associated with diseases such as Larsen syndrome, Brune-Belly syndrome, anterior tibial artery insufficiency, or even such as tibial hemimelia as well. As it has been associated with multiple disorders, therefore that is why exact pathway or exact problem which may be the actually root cause of all this issue is not known. Newly research which has shown actually there's involvement of transcription factor called as PIXT1 transcription factor, which is actually associated with also the maldevelopment of the talus, which may be happening over here. Problem is actually at the talocalcaneonavicular joint, and this maldevelopment of talus, which may be underlying multiple cause or may be associated with any syndrome, when this happens, This talus results maldevelopment of talus results in a certain abnormality in which the midfoot first goes into cavus, pushes the forefoot into adductus and hindfoot into Equinus varus, leading to clubfoot formation or congenital Talipes Equinovarus formation.